Hi, thank you for still staying in tune with us. Okay, talking about safety today, we have our hot doctor segment with our own resident doctor. Today we'll have a topic of heart problems and women. Let's introduce Dr. Dewi Ramasamy, the cardiologist from Gleneagles Hospital.
Good morning, doctor.
Good morning.
So,
Thank you for
doctor,
joining
since
us.
we are zooming in on women, so is it true that women are more prone
To heart
attacks or
than
heart
men?
problems if compared to men?
In generally, it's true. Although we say that women manifest heart disease 10 years later than men. But we manifest disease,
go later.
coronary artery disease, 10 years later than men.
10 years later.
But after the menopause, the onset of coronary artery disease is increased in women. And in fact, it is the #1 killer for women after the menopause. In fact, compared to all other cancers, it's about 2.5 times increased incidence of mortality due to coronary artery disease compared to all cancers. And in fact, women tend to have a higher incidence of mortality after the first heart attack, as well as for other cardiovascular causes like stroke and peripheral disease.
Understand. Okay, we have a graph on the screen. Can you explain more about the figures that we have?
Okay, you can see there's a decade, from 1999 to 2006, something like just less than a decade. The incidence of coronary artery disease seems to be the #1 cause of death compared to all cancers, and it's the same worldwide. All right, we have not reduced that incidence yet.
Okay. Now we know when talking about again heart problems and men, they all say that when you have the extra spare tire here, you are more prone to heart attacks. Now, is it the same with women? If you are bigger size,
Yes.
you have a higher, you've considered fat.
Increased incidence. That's true. That's generally true for men and women. The increased waist circumference predisposes you to coronary events. And of course, it's not just the waist circumference. It has to be additional other risk factors that most of them are aware of, such as hypertension, high cholesterol, obesity, smoking, diabetes, physical inactivity, and all this. These are all the other risk factors that both men and women have. But in particular, women, after the menopause, they tend to have all that, and there's an increased incidence.
I see.
So, doctor, tell us about the risk factors.
Okay, right.
Risk factors
You can
for
explain
heart disease.
how does heart disease affect you internally, and how does it look like?
Yes. Basically, we talk about coronary artery disease, risk factors as modifiable and non-modifiable. Modifiable are the ones that I mentioned to you earlier, something like hypertension, diabetes, high cholesterol, physical inactivity, obesity, and of course, some women in particular is the postmenopause. The non-modifiable factors are age. Age is non-modifiable. Premature coronary artery disease in the family, strong genetic tendency for coronary artery disease, and if women also have other associated cardiovascular diseases such as stroke, limb peripheral vascular disease, they are at higher risk than if they do not have one of these. But of course, when you're talking about smoking, hypertension and all that, these are all modifiable, and something can be done to prevent.
In a sense, what else should we do to reduce the risk of heart disease?
Okay, I think we're talking about modifiable risk factors. If you're a diabetic, I think you should be careful on how you surveil your sugar, monitor your sugars, keep your sugar level under control, have proper treatment as necessary, follow up with your doctors, and keep it really under control. That's very important, because as you know that diabetes uncontrolled leads to many other problems, not just heart, but other vascular problems as well. Hypertension, for example, women, in fact, after the menopause, it has been said that 80% of all women at the age of 60 have hypertension, right? So it's a very high incidence. And we need to treat them, not just lifestyle change. Lifestyle change we are talking about is physical activities, nutrition, healthy eating and all that. But that's not enough for some patients. The very high risk women will need medications. And most of them, I would say that women, taking medicines is not something that patients want to do that, or people want to do that. They would prefer to do all the other things. But then I think the aim is you have to get your BP under control, like 130/85 for women who have diabetes. So that's a gold standard for hypertension.
So, doctor, you brought some
Yes.
teaching aids.
All right.
So, anything to share with us?
Okay, shall I?
Yeah, yes, please. Yes, please. Which one?
Take one,
This
this model. Okay, right. Okay, this model is a model of a heart. It actually displays the coronary arteries. These are the important circulation to the heart.
Okay.
Any problem with this circulation, say for example, a sudden blockage in the artery can cause a heart attack. Right? So it can involve any one of the three main arteries. Why a coronary artery disease, a plaque rupture takes place is difficult to say, but we know the risk factors contribute. But why someone, is well, had a normal stress test, and suddenly 2 weeks later drops dead? The reason being is a plaque rupture. There may be some mild coronary plaques in the arteries which are not picked up on stress tests, but they are unstable and they're vulnerable. And any one of these issues, like for example, a very high cholesterol or stress levels or even sugar controls which are not right,
Okay. And what kind
can
of
predispose to
treatment?
plaque rupture.
What kind of treatment
Yeah,
that is available?
treatment for coronary artery disease, as you know, is divided into three groups. Medical treatment, which we give medications to patients. Interventional means, I'm sure you heard about angioplasty, stenting,
under the
and
knife.
patients. Yes, there's some form of balloon technique that relieves the blockage.
I see.
Or the other final one is bypass surgery for some very severe coronary artery disease in women, which is not amenable to either medical treatment or intervention. Then they are subjected to bypass surgery.
Understand.
But I must say that women, the treatment is the same as men in terms of the modalities existing, but the outcome is not as good as men.
Really?
Yes.
Because?
The reason is women tend to present late.
Oh, okay.
See, they don't
As you
come.
said,
They're
they
quite
come 10
different.
years
Yes,
later.
they manifest disease 10 years later.
Okay.
But when they come, with the problem, it's also late because their symptoms are not taken into consideration. Sometimes they go to the doctors. They have vague symptoms, not typical of men, like classical chest pain when you walk. When you do something, you have pain, and
That's
then
it,
you
the
rest.
classical men.
That's what men manifest, like most of the men. But of course, women may just feel tired, lethargic, weak. Those
It's like a
vague
silent
complaints.
killer for women.
It is for both men and women. It's a silent killer. So because of these symptoms, they're always told that it's part of your stress. It's not your
Part
heart.
of menopause, part of growing old.
Yes, that's all, and it's been brushed up. But by the time that arrive at your clinic or at the doorsteps, it's a bit too late, and the disease has progressed. Therefore, the outcome of whatever we do is not going to be the most optimum.
I see, I see.
So,
Do you have any advice for women who is going through this but they do not know that is the symptoms? What should they be alert
Yes,
on?
I think women should be aware. As you know, that I've already mentioned that it's the number one killer, for postmenopausal women.
So again, look for what? Be feeling tired?
Lethargic, get to see your doctor, especially after menopause. Make sure you go through some testing, diagnostic
Is it
testing.
possible for us to request, as you say, a lot of doctors brush off,
Yes.
just saying, it's just age, you just might be tired. So, is that something that we can request, a certain test?
Yes, you have the right, because I think those vague symptoms, you want to be sure that you, especially when you have risk factors. Like for example, you're a smoker, you're a diabetic, especially diabetics and hypertensives, and there's a strong family history of heart disease. I think there is a need for all this, and some form of diagnostic tool to be done, and to be sure that you do not have any significant disease before you are told that you just go on lifestyle measures and prevention.
All right,
so
thank
if
you.
anyone is comfortable with you out there, they can always look for you at.
No problem.
Gleneagles.
Any other
Gleneagles.
cardiologist.
Thank you very
Thank
much.
you.
Thank you. Thank you, doctor.
Thank you.
Thank you,
Right,
doctor.
thank you.
So that was the doctor's advice for the day, hot dog segment. So
We have
folks,
one last segment after this. Don't go anywhere. We'll be talking about Festival KL 2010. So
Yes,
stay
right.
tuned for that.